Yeah, don't sweat. Wedding. Well, good morning, everyone. Can you hear me okay? Great. Well, I'm Brett Anderson, the President and CEO of Ebenezer and the President of Senior Services for Fairview, and it is my honor to welcome all of you here this morning. Ebenezer, as a mission-based organization, has been serving older adults over 100 years. And we started right here in Minneapolis, but we now offer senior living across 120 communities in 6 states. And it is our honor to be here today at the Pillars of Prospect Park, which offers independent living, assisted living, and memory care, but is also nationally renowned for our intergenerational... There you go. Better? All right. It's our honor to be here at the Pillars of Prospect Park, which offers independent living, assisted living, and memory care, and is also nationally renowned for our intergenerational programming. We offer childcare, college student housing and engagement, and senior living all under one roof. And today I'm honored with all of our guests here, to our residents, families, and Ebenezer team members. Thank you for making this such a wonderful community. And to our distinguished guests, Senator Klobuchar, a champion of senior-related causes in the Senate. Dr. Joseph Gogler, the distinguished McKnight Professor of Long-Term Care and Aging at the University of Minnesota. And Robert Freeman, an advocate for Alzheimer's patients as VP of Public Policy for the Alzheimer's Association of Minnesota and North Dakota. Thank you all for being here today. Senator Klobuchar is renowned for effective public service and bipartisan leadership. Last Congress, she had the most bipartisan bills and was recognized by Vanderbilt University as one of the most effective senators. Her advocacy...
It's all relative.
Her advocacy for seniors is important. She fights for increased funding and expanded research for Alzheimer's and other dementias. It is truly my honor to introduce U.S. Senator Amy Klobuchar.
Thank you so much, Brett. Thank you, everyone. I had no idea we'd have this big of a crowd. Happy Thanksgiving. And it's just wonderful to see all of you. We know this is a time where we miss people, right, that are no longer with us. I miss my mom and dad very much. But we also get to see family members and gather together and try not to get into any arguments about politics. Okay, let's just try not to do that. We're going to move forward together. And I personally am excited to be getting back after this campaign season. And have a lot that we're going to be doing by the end of the year in the Senate and also into next year. And I'm going to continue to be in leadership in the Senate. I'm chairing the presidential inauguration. That is true. Now, we believe in the peaceful transition of power, and that is my job. That is my job. And so I've been working on that. I've been working on all of the work related to our senior issues. I'm really excited about the Medicare negotiation that we got passed, as you know. This last year, that was my bill, and we're already negotiating prices on drugs like Januvia and Jardiance and Eliquis, Xarelto. I mention it because I know some of you might be on them. So you don't have to raise your hand. That would be a HIPAA violation. But the point is that we have 15 more drugs that we're negotiating, and it's really going to bring these prices down, and it's been a really important part of my work. So I'm going to continue. That's in law right now, so we're going to push the next administration to make sure those negotiations continue. So that's something that's going to be a big priority of mine. But another big priority of mine is Alzheimer's research, Alzheimer's care, treatment, and everything associated with it, and making sure that our caregivers are respected and treated with dignity as well. Could we, any of the caregivers here, do you want to raise your hand? Family members visiting, anyone here? I met Marilyn's daughter. Marilyn said her daughter was amazing, so let's just get that out there. But that is a really important part of this work as well. So I want to thank all of you and Brett for hosting us today at this beautiful place, The Pillars, not far from where I live, actually. And with us today, as mentioned, is Dr. Joseph Gogler, who's the director of the University of Minnesota's Bold, I love that name, Bold Public Health Center of Excellence on Dementia Caregiving in the School of Public Health, as well as Robert Freeman, the Vice President of Public Policy for the Alzheimer's Association in our area. With Thanksgiving this week and the holidays just around the corner, I know many of us are looking forward to spending time with our families, but anyone who has a loved one with dementia or Alzheimer's knows that this can be challenging. It can be challenging for the person with dementia or Alzheimer's, and it's challenging for their family. And for some who are in a more advanced state, it is hard to realize someone doesn't recognize who you are, or they are not the same. And there have been some really difficult times for people in the holidays, and it's important. We know that gets us even more focused on our mission to get a cure for this disease, right? To do the scientific research that we need. But it also makes us step back a little and think about, okay, how are we going to handle this situation going forward? And I'm sure we'll talk about some of that practically. Just last week, and this is very timely, Congress passed a bipartisan law, which I've long worked on, to invest in dementia research centers around the country, like, and this is one of them, the University of Minnesota's Center of Excellence on Dementia Caregiving, which is one of 3 centers of its kind in the nation that provides evidence-based support for caregivers. We got $500,000 grant for this incredible program, and we are going to continue to try to up that amount with our budget at the end of this year. I will tell you that this is an area where we really have bipartisan support, because everyone in the Senate has a family member, knows someone. As you know, the average age of the Senate is, well, I'm not going to go into it. And so there's just a lot of understanding about these problems. So 1 in 3 Senate seniors, as we know, their end of their life has Alzheimer's or related dementia. Nearly 7 million Americans are currently living with Alzheimer's, including 100,000 Minnesotans. And in the U.S. alone, over 11 million caregivers provided over 18 billion, that's billion with a B, hours of care in 2020. And we just have those numbers to show you how much happens in 1 year to Alzheimer's and dementia patients. And that is why I'm so focused on this caregiver issue for people who want to stay at home, and then others choose to live in a great facility like this. And by the way, I just love how it's integrated with the neighborhood and that there are so many people. I love that there's a child care facility here. How fun is that for everyone, with over 100 spots, and good for the employees. The student housing, all of it is a really positive model for the nation. So you should be really happy, those of you who are residents, that you live here, because it's a very cool place. Oh, the director is going to clap. Yes, we're going to clap for that. Okay, so we know those numbers I just mentioned, and they're hard, right? Those are hard numbers about how many people get Alzheimer's. But I know that we are not all here for the numbers, because it's actually someone's mom or dad or grandma or grandpa or brother or sister. For me, as many of you know, this is personal. I was involved in Alzheimer's research and focusing on this before this happened, but now I'm even more committed than ever. And that was, my dad was diagnosed, Jim Klobuchar, who many of you remember, was diagnosed with late onset Alzheimer's. And we lost him in 2021, but I will say he was able to spend his life, including those years with Alzheimer's, surrounded by loved ones. It was during the pandemic, but he had some incredibly loving caregivers. I think for those of you who remember my dad, he was very talkative to the end. He had some people, there were some of the caregivers from Liberia, and they had a dictionary by his bed because they would always learn new words, and most of them were okay words, not all of them. One day they called me up and they said, they looked it up. Is it true your dad had lunch with Isaac Newton? I'm like, no, that is not correct. That is not correct. But in truth, he had such a strong faith to the end. He would talk a lot about that. He would remember everything about Ely, Minnesota. The Notre Dame fight song was a big popular thing. And mostly, he just had a sense of joy. And I know that's not how this disease hits everyone. I'm not naive about that for those family members here. But we were fortunate in that way. But at the same time, I remember when he wouldn't remember who people were, before he got in the assisted living, when he would drive somewhere and not know where he ended up, where one of his friends called me from a bank in Wayzata, and I told him that he had Alzheimer's, but they didn't believe it because my dad was so talkative. So the friend called me, he's like, oh, we're in the bank. And I'm like, yeah. Well, your dad wants to take out $1,000 in $1 bills. And I go, he is in a memory care unit. What did you think? So I had those same frustrations, and one of the things that helped me get through all of it was actually the Alzheimer's Association, in terms of I would go around the state and go to some of the meetings in my official capacity and talk to them about what we could do better and what we should fund. But yet it was kind of a therapy session for me, but they didn't know my dad had it because it was at the beginning. And so it is hard because, my dad was this newspaper man who interviewed everyone from Ginger Rogers to Ronald Reagan to the Chicago Bear coach Mike Ditka, which was a wild interview. He was the outstanding newspaper columnist in 1984. And yet at the end, he didn't remember a lot of that. And that's a hard thing to deal with for anyone in a family. So, like so many others, my dad had people who loved him and cared about him. But that's hard for some people if they live for a long time and their family members live somewhere else. And that's why it's important at this time of year that we think about how we can reach out to people who may be in a really hard place. I continue to be committed to the work that we're doing and get this federal funding into Alzheimer's research. Earlier this year, for the 10th year in a row, we worked to secure a funding boost to NIH. And over the last decade, Alzheimer's and dementia research funding has increased more than 5-fold. And that is the momentum that we need to keep going. We are pushing to expand the funding for the NIH's BRAIN initiative and the Defense Department's medical research programs. You wonder why it's there. Well, they do a lot of research, and we're able to get funding through those programs. That's how we've gotten in the past and will continue to get cutting-edge treatments, medical technology, and detection methods for brain conditions. As the University of Minnesota and Mayo and other lead researchers in the nation have found, the earlier you can detect Alzheimer's and dementia, the earlier you can get people the care they need and help them out. And so that is also a piece, interestingly enough, of unlocking what happens to cause the disease. Because if you can catch it earlier, you're going to be able to follow someone better, and it really helps to get a cure and to get better treatment. I've worked on this wandering issue. You may be aware of that. You don't see it, of course, as much in places like this, but when people are in their homes, they can suddenly wander away into the cold, into freezing weather. And interesting, we got Senator Grassley and I, he himself is 92, whatever, he's very, very with it. But he and I actually got the Alzheimer's Association and the Autism Group to combine, and we passed a bill to fund devices that would connect up to police departments for people who can wander, because it's the same issue with kids with autism as it is with some of our seniors with Alzheimer. So we have made some progress, but we know our work is far from done. Here in Minnesota, caregivers can reach the Alzheimer's Association 24/7 helpline, as you know, at 800-272-3900, or the Minnesota Senior Linkage line at 800-333-2433. So we want to send strength and love to everyone in this day before Thanksgiving, and just remember to just be that little extra patient and a little extra kind when you know someone is struggling with dementia or Alzheimer's. So thank you very, very much. And now I get to turn this, oh, thank you, yes. I get to turn this over to Dr. Gogler. Thank you.
Hopefully everyone can hear me in the back. Well, I have to say this. I've given many talks, many presentations, and all different the mic's off. I am trying to be loud. And I've given many talks, many presentations to all different audiences. Whoever put this itinerary together did not do me any favors, having to follow Senator Klobuchar. I mean, I wanted to thank the senator for all of her efforts to advance our understanding of living with dementia, seeking a cure, and also how we can best care for people living with dementia. In today's day and age, as we all know, finding anything with bipartisan support is rare. But this indeed is a topic that has bipartisan support. So I thank Senator Klobuchar for her leadership. I thank all of those in Congress for their leadership, the Alzheimer's Association, and certainly Ebenezer and the Pillars for being so kind to have me here today. So as Senator Klobuchar mentioned, I might as well call her doctor, right? So as Senator Klobuchar mentioned, I direct a center at the University of Minnesota. It's called BOLD. BOLD stands for Building Our Largest Dementia Infrastructure, Center of Excellence on Dementia Caregiving. There are 3 national centers across the U.S. One focuses on early detection of dementia, which you just heard is very important. One focuses on risk reduction, so what we can do to actually prevent or stave off risks related to dementia. And then there's a third, which is on caregiving, which is our center. And you might ask yourself, well, why is dementia a public health issue? Why is dementia caregiving a public health issue? And you heard the numbers that Senator Klobuchar shared. Over 11 million people are caring for someone living with dementia. Close to 7 million live with dementia in the U.S. In Minnesota, there's around 164,000 dementia caregivers. And just think with me, when we think of long-term care in the United States, long-term care for people living with dementia, as wonderful as places like the Pillars are, as wonderful as many home health agencies are, that is not the heart of the long-term care system. The heart of the long-term care system is this vast unpaid network of family members, loved ones, and others. And if you actually put a dollar value on the amount of care that that families provide to people living with dementia in the U.S., that number would be 9 times the value of McDonald's revenue in any given year, half the revenue in Walmart. That's how much we rely on families. Okay? The question is, can we continue to do that? There are certainly trends that suggest there might not be as many available unpaid caregivers to help people living with dementia, and I really must acknowledge the work that family caregivers do, how heroic it is. But can we continue to rely on that as a long-term care system? And the answer, quite frankly, is probably not. This is why federal investment, local investment in dementia as a public health issue is so critical. And again, without the support of Senator Klobuchar and others, we couldn't do what we do at the University of Minnesota. Okay. I could go on and on with statistics. I know you don't want to hear that. So I want to be more personal in terms of what does it mean to be caregiver, and what are those experiences like? Now, Senator Klobuchar, she visits every county in Minnesota each year. And I heard that, and I was inspired by that. I said, "Why? I'm going to do that too, and I'm going to visit every county in Minnesota to really hold conversations about dementia and what it's like to live with dementia and care for someone with dementia." Now, Senator Klobuchar is much more efficient. She can do it in a year. I'm doing a county a month, so I got a ways to go. There are 87 counties in Minnesota. But this past Friday, I was just in Brown County, and I visited New Ulm and then also Springfield, Minnesota. And Rosalind Carter said this best: you either, one, are a caregiver, have been a caregiver, or will be a caregiver. Okay? So when we think of the importance of dementia and dementia caregiving as a public health concern, it is the pillar of the long-term care system, but it's a pillar that requires ongoing support. And it's these types of investments that allow that. Okay? Last point I'll make is when we think of dementia itself, as a public health issue is oftentimes Alzheimer's is seen alongside other chronic conditions. Heart disease, lung cancer is another chronic condition. Folks, it is the chronic condition. It complicates the management and living with all these other different conditions. So the more we can do to elevate dementia as a public health concern, and I see Patty here from the Minnesota Department of Health is up front. She has done great efforts. She is a state, and Minnesota is a state bold recipient, again, benefiting from this wonderful investment. And we at the University of Minnesota have benefited greatly as well. Thank you for everything you do, all of the staff here at Ebenezer, all the great work you've done. I mean, you are heroes to me, and we so value and recognize your work, and certainly to those family members too. So thank you. At the University of Minnesota, we're always here to help. Don't ever hesitate to reach out to us, and we're here to support you in your journey living with dementia or caring for someone living with dementia. So thank you. So I'm going to introduce a very, very good colleague of mine, Robert Freeman from the Alzheimer's Association.
Okay, very good.
Thanks, Dr. Gogler. It's an honor to be introduced by you. The university is doing such tremendous work to support caregivers. So thank you. Good morning, everyone. I'm Robert Freeman, and I'm proud to serve as the Vice President of Public Policy for the Minnesota North Dakota chapter of the Alzheimer's Association, an organization that's deeply committed to improving the lives of those affected by Alzheimer's and related dementias. I want to thank Senator Klobuchar humbly for her leadership and steadfast support in the fight against this devastating disease, as well as for the bipartisan Bold Reauthorization Act, which is a significant milestone in this journey. The association has long been at the forefront of advancing public health approaches to address Alzheimer's through research, education, advocacy, and support for families. We're striving to turn the tide against this disease that impacts more than 100,000 Minnesotans. The BOLD Act, which was first passed in 2018, established a public health framework to combat Alzheimer's disease. Its reauthorization strengthens this work, allows public health departments like MDH across the nation to continue building critical infrastructure and fund state, local, and tribal health departments to expand education and awareness campaigns, improve early detection, and promote risk reduction strategies. With the extension of this program, we can reach even more families and communities and provide the resources they need to navigate an incredibly challenging journey. It also amplifies the importance of partnerships. Public health strategies combined with the passion and resilience of the Alzheimer's community can change the trajectory of this disease. The association is honored to play a vital role in supporting these partnerships, and we're eager to continue working with lawmakers on both sides of the aisle, like Senator Klobuchar, to ensure these programs flourish. Advocacy is at the heart of what we do, and I want to take a moment to share a story that underscores why this work matters so much. In September, I had the privilege of working with a gentleman called Doug who shared his Alzheimer's journey with me. He spoke about his wife's diagnosis and how the disease had upended their lives, but he also shared how access to caregiving and support programs made possible through efforts like the BOLD Act gave him the tools and support to care for his spouse right up until the end while advocating for his own well-being. His story is one of thousands, a reminder that our advocacy is not just about policies or funding, it's about people. Each program we fight for, every dollar allocated directly impacts lives, and it's these individuals and families who inspire us to keep pushing for a world without Alzheimer's. As Thanksgiving approaches, we're thankful in the dementia community that we have entered an era of treatment. For the first time in history, we have FDA-approved treatments that can slow the progress of the disease, and we want to build on that. And in December, it's Alzheimer's Awareness Month. These treatments are most effective early on in the diagnosis, so it's imperative we continue to build out the infrastructure needed to promote awareness, early diagnosis through bipartisan, data-driven initiatives like the BOLD Act, as the science continues to improve everyone's lives and put us on the path to a cure for once and for all. And then, as it's the holidays, I just wanted to share some tips for caregivers. Holidays can be really stressful, as Senator Klobuchar mentioned, especially for caregivers. So be realistic, set expectations with your family, ask for help if needed. Involve your loved ones who are living with dementia in simple holiday preparations like decorating or baking or singing. Prepare quiet distractions or like a photo album or a place to be quiet if they get agitated. And then people living with dementia can become confused in the evening, something we call sundowning, and so consider celebrating earlier on in the day. And then finally, focus on things that will bring you happiness, and if you think it will be too stressful or difficult, give yourself permission to let it go. If you want to learn more about the work of the Alzheimer's Association is doing, please visit our website, alz.org/MNND, or call our 27 helpline with questions at 1-800-272-3000. 3900. Thank you, Senator Klobuchar, for championing this cause, and thank you all for your ongoing support. Together we're making strides towards a bright tomorrow. Thank you, and happy holidays. And with that... And with that, I'll turn it back over to the Senator. Thank you.
Okay. Very good. So Ben, should we take any questions from the media here? Are we good? Okay. Okay, good. Well, thank you, everyone. This is just such an incredible group. Maybe we'll turn and we'll do a picture with all of you sitting there, right? So, because we probably can't do, so that'll be fun. We'll do that here. I'll move this over maybe. But thank you, and have a really happy Thanksgiving. We're excited. Our daughter is here without her dog. Should be good. She's going to make pies tomorrow, so it's all good. So thank you, everybody. Thanks.
Stripped. Didn't see that what they were saying there. Patience. What was that? Yeah. Like snacking for a while.
Everybody smile. Great. Okay.
That's a great sweater.
Yeah. Okay. Well, thank you, everybody. Thank you so much.
Yep, I got you.